morning, everyone. My name is Calvin Blake Johnson, and I'm going to do a presentation on antibiotics this afternoon, and thank you for attending. First thing I want to go over here is, why do we need antibiotics? Nearly 50% of hospitalized patients receive some form of antibiotic. All achievements in medicine are attributed to antibiotics. Common antibiotics you've probably taken by mouth, or you probably had an IV before if you've ever been hospitalized. Amoxicillin, azithromycin, levaquin, just some common names there. When to use antibiotics. This is what we're trying to harp on today here. Antibiotics should be prescribed for bacterial infections, not viral infections. Antibiotic is not going to do anything for a viral infection. A viral infection has to run its course. Antibiotics should be, at least 90% of upper respiratory infections are viral in source. So that tells you just how we abuse the use of antibiotics, just due to our education on antibiotics. Examples of viral infections: sore throat, cough and colds, flu, acute sinusitis are all viral in origin, not bacterial, and do not need an antibiotic. Examples of bacterial infections: we got bronchitis, sexually transmitted disease, some urinary tract infections, and we do have some upper respiratory tract infections that are bacterial in source. Identifying the bacteria. Now, say someone comes into the emergency room, we recognize that they got a bacterial infection. We'll do a culture and sensitivity as soon as possible. We'll start with some broad spectrum antibiotics, and we send that culture and sensitivity to the lab. It could be wounds, sputum, urine, blood. It could be all the above. We want to try to identify that exact bug that is causing the infection, so we can get the exact antibiotic that works the best to treat that bug, and start transitioning off of those broad spectrum antibiotics. This will help us prescribe the correct antibiotic in a timely manner and not overuse those broad spectrum antibiotics. Bacterial infection, some signs and symptoms there is loss of appetite, symptoms of dehydration, edema, pain. Now, a bacterial infection is going to deplete your cell of water, so you will be dehydrated. So it's very, very important you try to drink as much fluids as you can, as much as you can hold down there. Sometimes you can have an absence of a fever, or a fever greater than 102. Cardinal treatment points. Use the most effective antibiotic. That goes back to the culture and sensitivity. As soon as lab microbiology figures out that exact bug, a lot of times the report prints right behind it. It tells you the sensitivity of that bug to that antibiotic. And that's something as nurses we can kind of double check behind physicians just to make sure we're on the right antibiotic. That's something a physician is not going to care one bit about you paging him for, to get that patient on the correct medication. Use the antibiotic with the narrowest spectrum possible. Use the antibiotic with the lowest toxicity possible. There are some antibiotics, such as gentamicin, they're very nephrotoxic. So especially somebody with some chronic kidney disease, we really want to try to stay away from a medicine like that if we can, if possible. If not, there are ways to treat a patient like that. We just have to be real meticulous in the way we go about doing it. Use the antibiotic with the lowest potential for allergies. That's any medication. Make sure you always double check those allergies, because the last thing we want to do is cause an allergic reaction for a patient who came in with a bacterial infection. And use the most cost-effective antibiotic. That's something we try to do in every area as healthcare providers as well. Sometimes it doesn't always work out that way, but that is something we try to keep in mind. It is on the priority list, it's just not at the top. Patient education. Take antibiotic as prescribed. Do not discontinue when you feel better. A lot of times you can be on a 2-week regimen. Day 5, day 6, the patient starts feeling better. Like, hey, I don't want to take that pill every day anymore. I'm done. and they don't realize that the bug is not completely gone. It's not completely defeated. And what happens is these bugs come back and they mutate and they become resistant to that antibiotic that you took for that 5 or 6 days. And then all of a sudden you get sicker and you're trying to take those same antibiotics and the patient's a little upset that they're not working. This could cause them to have to come back into the hospital. It could cause them to actually get dehydrated. And it's just something we really need to educate on, because this is becoming increasingly a problem within our population. Drink 2 quarts of water a day. That goes back to the bacteria is depleting the cells, so please make sure you preach that they need to try as much PO intake as they can. They might vomit, have just vomited 2-3 hours ago. As long as they just try sips, try to get down as much as they can. Your body's immunocompromised, so get adequate nutrition. If you're able to get to a point to take solid foods, try to take some that are high in vitamin B, vitamin C, help your body out to fight that bug off. Take with food if nausea occurs. A lot of these medicines will cause nausea. They upset the stomach. They got some GI irritability. So you might just need to take some nabs with that big old Cipro pill just to make sure it doesn't cause any nausea. Report all signs of allergies. Rash, shortness of breath, hives, severe itching. You might need to get to the emergency room as soon as possible. If the symptoms are severe enough, try Benadryl at first with a rash, but if you have any shortness of breath, any breathing difficulty at all, call 911, get to your nearest emergency room possible, please. Common side effects of some of these antibiotics are GI distress, nausea, vomiting, and diarrhea. The vomiting, of course, can be from the infection as well. Kind of hides itself in there. Caution, okay, for teenagers, ladies in their 20s, antibiotics do decrease the effectiveness of birth control pills. So make sure you're using alternative measures when you are on antibiotics. What is misuse of antibiotics? The first one, when prescribed unnecessarily. When prescribed for those viral infections, that person didn't need those antibiotics for a viral infection. When broad spectrum antibiotics are used too generously. You do the culture and sensitivity, you get it narrowed down to this antibiotic works 85% effectiveness for that bug. Well, we need to start transitioning the patient off of those broad spectrum antibiotics as soon as possible. When duration of the antibiotic treatment is too short or too long, again, preach to the patient. If it says take for 14 days, you take for 14 days. You don't take for 8 days, 9 days. When the antibiotic dosing is too high or too low for this certain patient. A lot of these can be off weight based, the size of the person, and that's something the physician will take into counter there when he prescribes the antibiotic. Cost associated with bacterial resistance. All right, risk for hospitalization. Patient didn't finish that antibiotic regimen. The bug comes back stronger. They try to finish the pills. Well, they're not getting any better and come to the hospital. And it's taking that antibiotic along with 1 or 2 other ones and probably fluids as well to get this patient better. So there's a risk they could be hospitalized all because they didn't finish this regimen. Increased hospital stay. If somebody already has an extensive medical history, this could increase their stay. Treatment failures. Cost for more expensive treatment failures. Some bugs get so resistant we have to dip into our bag of old school antibiotics that can be costly and have to get shipped in from other places around the world. Problems associated with chronic illnesses patients may already have. Especially here in Mississippi, our population has congestive heart failure. They have COPD exacerbation. They have chronic kidney disease. They have diabetes. With all this going on, the bacteria is going to shoot their sugar up. We're going to have to give them fluid with CHF. We're going to have to possibly give them an antibiotic that's nephrotoxic. So we could be causing minor complications as we weigh them, but over the course of time in a 5, 6, 7 day hospital stay, it could really take a toll on the patient. And depending on which direction they go, it could actually cause mortality. Antibiotic stewardship, monitoring the appropriate selection, dosing, route, duration of the antibiotic being prescribed to the patient. We must manage carefully due to the slow progression of new antibacterials being produced and infectious diseases still being the most common cause of death around the world. Antibiotic stewardship is a patient safety issue. To ensure that the training and education is working, there should be extensive collaboration between the antibiotic stewardship, the infection prevention team, and the infection disease physician within the hospital setting. And last but not least, the number one way to prevent these bugs from spreading to other patients and to yourself is hand washing. Going into the room and leaving the room. Please wash your hands. And thank you all so much.